at American Back Centers. You've got nothing to lose but the pain.
The following program, BackTalk, is sponsored by American Back Centers.
At American Back Centers, you've got nothing to lose but the pain.
Welcome to BackTalk with Dr. Peter Pedduzi, located at 103 Bradford Road, Building 2, Suite 100 in Wexford. Now, with BackTalk, here is Dr. Peter Pedduzi.
Good morning, everyone. This is Dr. Peter Pedduzi with another episode of BackTalk. Excuse me. I like to start off each and every week. I like to say hello to all our loyal listeners. Thank you for listening each and every week. And a special hello to anyone who is new to this radio show. This, again, is BackTalk with myself, Dr. Peter Pedduzi. We're on every Wednesday morning on KHB 6:20 a.m. from 9 to 10 in the morning. If you are new to the show, as I do quite frequently, give you a little overview about what we're going to be talking about this week on BackTalk. And typically in the first half hour, we talk about the very unique and wide variety of treatment options we offer all under one roof. And we've been doing this for almost 50 years now here at the American Back Centers. Dr. Dennis Miskovich started this practice almost 50 years ago. In the last 20 years, we started specializing, and we've been known as the Pittsburgh area's disc specialty center, Pittsburgh's premier spine and disc specialist, because we've been doing it for over 20 years now, helping people with these difficult disc-related conditions with a therapy called VAXD therapy, which is the only FDA-approved, safe, clinically proven, non-surgical disc treatment out there. A lot of people out there touting their so-called disc treatments, but again, if you do the research, you will see that this treatment has been around for over 20 years. Again, we've been doing it for over 20 years now. It's been around since 1992. We started doing it in 1994. It was put on the market in 92, and they started seeing great results even back then. Channel 11 did a report on our office, and it was broadcast on Channel 11 News about 10, 15 years ago, and we continue to help people. And we have the latest technology. We don't have 20-year-old technology. We've VaxD's upgraded their technology, and we've got the new machines, and they continue to get better and better. And our protocols are unique. The way we deal with the patients as far as different modalities that we add to their plan of care has changed and has increased our success rate with these in some cases, very difficult disc-related cases, herniated disc, bulging disc, sciatica, stenosis, and even patients with failed back surgery and multiple failed surgeries where they've been to every doctor known to man. They don't want to get another surgery. They have permanent complications now, scar tissue, other permanent issues that result from a failed surgery, and they're desperate. And they come to us, and in many cases, if not most cases, especially if we feel you're a good candidate for the therapy, you're going to do well with this therapy. It has an extremely high success rate, much higher than anything that's out there. And there's approximately 3,000 patients a day worldwide at over 300 facilities. There's medical doctors, orthopedic surgeons in private practice, a few hospitals, chiropractic physicians, as well as physical therapists using and all seeing the great results and the great research that have gone into this procedure called VaxD. And that's what we talk about, some of the latest and newest treatments, and talk about VaxD and some of the other treatment options we offer right here at the American Back Centers. In the second half hour of the show, we typically pick out a nutrition or fitness-related topic. We were not live last week, but 2 weeks ago when we were live, we talked about how to safeguard your bone health naturally and some natural ways to deal with that. Some of the supplement and dietary issues, some of that you can receive at our office. You can pick up at our office the supplemental issues, supplements, I should say, and the dietary issues we go over with our patients. This week we're going to be touching on the number of people suffering from osteoarthritis has doubled. Why has that occurred? We're also going to talk about, if we have time, why arthritis patients shouldn't rely on prescription drugs. So we'll touch on that. So we're going to be talking a lot about arthritis today. So if you know someone, you yourself are suffering with arthritis, definitely stay tuned for the second half hour of the show today, touching on some natural alternatives to those prescription drugs, dietary issues, as well as other natural methods that may help you avoid some of the dangers of the side effects of the prescription medications that you may be taking that may be causing more harm than good, as well as some of the natural ways you can help deal with arthritis and the pain and the suffering that's involved with this. And again, the number of people suffering from osteoarthritis has doubled Unbelievable, and we're going to be touching on that. I'm sure you may have known that in the second half hour of the show. Into the next few weeks, we're going to be touching on headache issues. So if you have issues with headaches, recurring migraines, tension, cluster headaches, touching on some natural ways to deal with those. Of course, getting an adjustment from a chiropractor. In many cases, if a nerve is impinged, causing the headache issues, looking at dietary issues that you may be causing, food allergies, different foods or dietary issues that may be triggering your headaches. We'll be touching on that in the next few weeks as well, so definitely stay tuned for that. We'll also be putting that up, and all the articles we touch on BackTalk are always on our Facebook page, American Back Centers Pittsburgh. Take a second to visit our page, American Back Centers Pittsburgh. If you can take a second to like our page, we would appreciate that. As well as all the articles you can print right off the Facebook page, and you can read them on the page, or you can print them off if you like, right on our Facebook page, so you'll never miss what we're talking about on a show. If you miss a show, you can always go on there and print off the article which we're touching on each and every week on BackTalk. So again, American Back Centers Pittsburgh, check that out. You can like our page. We'd greatly appreciate that. You can follow us, and you can go and print out the articles each and every week that we're live, that we put them up there, and we've been putting them up there every week that we're live on the show. Occasionally we have to run a tape. We have to do different things with my kids, and I can't always run a live show, so I do apologize. But when we're live, that will definitely be up there each and every week. And even the tape shows are from a year ago. Typically we do, so we're staying time-related, so I'm not mentioning, say, the snow outside when we're in August. So typically those articles can be found somewhere as long as they're not over a year. We've been doing it for about a year now on the Facebook page. So any more than a year, they're probably not up there, but we typically don't do shows more than a year, so they should be up there. Almost all of them should be up there. You should be able to find them somewhere on that Facebook page, American Back Centers Pittsburgh. Next few weeks, too, we're also going to be highlighting our new dietary program. And I hate to call it a diet. It is a diet per se, but they call it 6 weeks to a new you. And most people are losing 20 to 35 pounds in just 6 weeks when following our new program, which we're going to be offering here at the American Back Centers. This involves no shakes, no exercise, no prepackaged foods whatsoever, no bars. It's doctors designed and doctors supervised. And we're going to be touching on this in the next few weeks, so definitely stay tuned for that. Amazing results across the country. People doing this program, and we're going to be offering it here at our office, losing 20 to 35 pounds in just 6 weeks with no exercise, drugs, prepackaged foods, shakes, or bars. You may ask, how can you do this? Well, we're seeing it. We're seeing it all across the country, people doing this diet program, and we're going to be offering it here. We're very excited to start offering it here in the next few weeks here at American Back Centers. So we'll be touching on this when we have time the next few weeks on BackTalk, so definitely stay tuned for that. Of course, I always recommend that people exercise. But in some cases, patients are looking for a program which allows you to lose weight without exercise, without drugs, of course. Prepackaged, you don't have to buy any food, you don't have to buy any shakes, any bars. We're not looking to make money with you buying these foods and bars and such like that, because there's nothing involved with that. So it's a very easy program as long as you follow the program. Again, it's doctor supervised and doctor designed, and amazing results, and we'll touch on that in the next few weeks. So definitely stay tuned for that. Stay tuned. Listen to BackTalk. We'll be talking more about that in the next few weeks. So, of course, the American Back Centers, we talk about this each and every week. We are not your typical chiropractic office. As I mentioned, since 1994, over 20 years ago now, the American Back Centers has specialized in the treatment of very difficult cases, including herniated disc, bulging disc, failed back and neck surgery, sciatica, stenosis, degenerative disc disease, and other serious health-related issues, which many doctors have not been able to help. And we have these people, and I call it the gauntlet. They go and they self-medicate. They go in the bathroom, get a Tylenol, ibuprofen when they have back pain or neck pain. They self-treat themselves. The pain goes away. Then it comes back a month later, 2 months later. Worse or more severe. Now the pain is in their hip, their buttocks, their groin, down their leg, numbness and tingling, more radicular pain. They go to their PCP. They get checked out. They put them on a steroid pack. That takes the pain away. Little do they know that that's just a Band-Aid. In many cases, that condition is still progressing in their body, the compression on the spine. And I go, again, if it is compression on a disc and on the spine, I tell patients it didn't happen last month when you were in the yard digging or when you were throwing catch with your son in the backyard. And then you noticed all this severe pain. It most likely happened in the last few months, if not years, slowly progressing. When you had that back pain, you took that pain pill, it went away. Then it came back a month later, a little bit worse. Then you went to your PCP, got a steroid pack, possibly. Prescription pain pills. Then they send you to physical therapy. If it is a disc problem occurring, again, the physical therapy itself does not address the disc. It addresses the muscles. In some cases, strengthening the muscles will allow the disc to heal itself. But if it doesn't, then they send you to a pain clinic. You get pain shots. The pain shots we all know are Band-Aids, doing nothing structurally to counteract the compression on the spine and the disc, contributing to your sciatica, your numbness and tingling, your pain, your disc bulging, if it is occurring. And in many cases, you don't know it's a disc problem because you've never had an MRI. You've had no need to get an MRI in your mind. So you're getting these pain shots. You may feel better temporarily, and then when the pain shots wear off, the pain comes back. Then they tell you to go to a surgeon. The surgeon tells you that you don't need surgery right now, you're not a good candidate for surgery right now, come back and see me later if the pain returns. You go back and do therapy again, you may get some more pain shots again, and then when that doesn't work in many cases, then you go back for surgery. Hopefully, somewhere in there, you will hear about us, and you will see there is an effective, safe research alternative to simply resorting to going under the knife. We all know that back surgery has a very low success rate, a high rate of permanent complication. You see it over and over and over. We talk about how snipping off a piece of the disc, whether through a laser, tremendous out-of-pocket expense, Laser Spinal Institute, $20,000 to $40,000 out of pocket. They don't tell you that when you go in there. And they also don't tell you it's no different than using a scalpel. It's not any less invasive. They still have to rip out ligament, bone, and tissue before that laser goes in, causing possible, if not certain, damage. And then the laser does very similar to a scalpel, just snipping off a piece of the disc that's bulged or herniated, not addressing the compression on the spine, so the spine still continues to compress, the disc still continues to be starved of nutrients because of the compression, the bone spurs, if forming, still continue to grow, and eventual fusion of the bone can occur. All of this is not addressed, so the pain comes back, and guess what? In many cases, you got to go back and get another surgery. Not in all cases, but in many cases, you have to go back and get surgery again. Sometimes a fusion surgery, which involves rods and screws. We all know that's a last resort surgery with many complications. We're not even mentioning the scar tissue that can occur with any surgery, infections that can occur with any surgery, blood clots that can kill you, that can occur with any surgical procedure. So that's why we're out here. That's why we do this radio show. Hopefully, we're educating you on a natural, safe alternative. So you will tell your friends, your neighbors, your relatives, anyone who's unknowingly going under the knife that has no idea that VAXD even exists. And it's unfortunate. We get many referrals from local medical doctors, PCPs, other chiropractic doctors, and so on. But many of them don't fully understand how VAXD works. Some of them think, since it's done by a chiropractor, that it's some sort of an adjustment or it's a traction device. And there's a lot of confusion now because there's a lot of these other so-called decompression devices out there. In many cases, they don't even call themselves decompression. They just say that they have the latest and newest disc treatment, helping people for their disc problems. And when you look closely, they're glorified traction devices. And a lot of medical doctors assume that VAXD is the same thing. Even though VAXD's been around for over 20 years, it's helped countless people. 3,000 patients a day are currently being treated. Some of the best athletes in the NBA, NFL, NHL, Olympic athletes, actors. We've had a few actors here at the office. They've been helped. People see this treatment is remarkable, and it's research, and it works. Time-tested. It's very safe. As I mentioned, 300 facilities worldwide, hospitals, medical clinics, chiropractic physical therapy clinics, orthopedic surgeons in private practice use VAXD. not these other so-called disc treatments that are out there. This, of course, again, is vertebral axial decompression, VAX-D. So as I always ask each and every week, if you're out there listening, you yourself or you know someone who's suffering with severe back pain, leg pain, even neck pain, which we'll touch on with the cervical treatments here in a few moments, unresponsive to your current treatment, you want to avoid further pain medication, pain shots, epidurals, physical therapy not working for you, may actually be causing the problem to get worse. You want to avoid surgery. You've already had surgery. Surgery has not helped you. In some cases, made your problem worse. They call successful surgery, they call surgery successful even, which really bugs me, even if you only have pain relief for a month or 6 months to a year. But then if the pain comes back, they still call that successful. And that's what goes into their artificially inflated success rates, and you need to know that. So don't listen to these so-called success rates you hear out there advertised. Many of them are artificially inflated. You want a procedure like VAX-D that has permanent results, 4 years plus, patients still pain-free. This is documented through medical journals. So if your symptoms are radiating into your hip, your buttocks, your groin, down your leg, numbness and tingling, weakness, foot drop, these are all common presentations that we see here at the American Back Centers, and in many cases we're able to help you avoid further suffering and disability with an FDA-approved procedure specifically for these type of problems. Whether you have disabling low back pain, radicular pain, herniated bulge, degenerative disc, extruded disc, degenerative joint disease, arthritis, sciatica, stenosis. Spinal stenosis is a lot of times caused by a disc being pushed out and narrowing that canal. Also very effective with failed back surgery conditions. And as I mentioned, multiple. We have people coming in here with 2, 3, 4, 5 failed back surgeries or more, and we are still able to help them in many cases. So again, this breakthrough technology, if you are new to VAX-D, was developed by Dr. Alan Dyer, who is the former Deputy Minister of Health of Canada, who pioneered the research on the heart defibrillator, used, of course, all over the world. This research to develop the VAX-D treatment was conducted over a period of 6 years with the combined efforts of physicians, engineers, and technicians at major hospitals. So over 300 facilities, we are doctors dedicated to bringing you long-term relief and avoiding the need for surgery now as well as into the future. Don't wait until your condition worsens. Call us today. Our toll-free number to schedule a consultation is 1-888-222-8293. Again, 1-888-222-8293 or 724-935-3300, 724-935-3300. We also give out the fax number because we do encourage patients to fax over their reports. So this is the typewritten report when the radiologist actually writes out his interpretation of what he sees on the X-ray, CT scan, or the MRI. So in many cases, it's much easier to get that than rather going to the facility and picking up the films for patients. So a lot of times you can just call over wherever you had it done at the hospital or the MRI clinic or the doctor's office if it's an X-ray, and just say, hey, can you fax over the doctor's report to this doctor, or fax it over to the American Back Centers. So our fax number is 724-935-3321, 724-935-3321 is the fax number to fax over reports to our office. Many people do that. They're coming from a great distance. We have people coming from hours away. Of course, we do have a list of hotels on our website if you need overnight lodging. www.americanbackcenters.com is our website, and you can find that on that website. But, again, you can fax those over. We can take a look at those prior to you scheduling or after you schedule, so it's ready for us. When you come in for your consultation, you can have those faxed over as well. Saves you a trip so you don't have to go pick it up. They can just fax it over for you, 724-935-3321. And again, to schedule the consult, 724-935-3300 or toll-free 1-888-222-8293. You can also request an appointment right on our website, www.americanback.centers, plural, with an S, .com. You can also learn more about the VAX-D therapy, Some of the other services, which we're going to go over here in a few seconds. Blog and patient education section. Remember, you can sign up for our daily health update newsletter, as well as our monthly In Good Hands newsletter. Some of the greatest minds in the country from the Cleveland Clinic and all over the country contribute to the monthly In Good Hands newsletter. So you get that once a month. It's about 7 to 10 pages sent to your email. And every day you receive health tips free of charge and an inspirational quote sent right to your email by signing up for the daily health update newsletter under the patient education blog and patient education section of our website. We have some great testimonials on our website and contact information. And again, of course, you can request an appointment right on the website. We usually get back to you within 24 hours when you request an appointment on the website. Again, www.AmericanBackCenters.com. In addition to the VAX-D, again, the VAX-D is a medical procedure, the only FDA-approved, safe, clinically proven, non-surgical disc treatment out there, used by all specialties in over 300 facilities worldwide. Approximately 3,000 patients a day are being treated with VAX-D. Nothing comes close to that. None of these so-called disc treatments even come close to the amount of patients being treated per day, as well as the facilities using it. We also offer cervical disc treatment options, so if you have a disc problem in the neck region, you don't want surgery, you've already had neck surgery, it doesn't work for you, we have great success with those type of problems. Cervical radiculopathy from a car accident, whiplash cases, numbness and tingling in your fingers, hands, weakness in your arm, bulging disc in the neck, herniated discs, degenerative disc disease in the neck, and even failed neck surgery. If you're contemplating neck surgery, at least come and see us first. Get a second opinion first before you blindly undergo the knife. Please, please, please do that. We've helped so many people avoid neck surgery and the possible complications that can be involved. Even if you've already had neck surgery, we've helped patients as well avoid another neck surgical procedure. Again, this treatment is remarkable, both the VAX-D and the cervical disc treatment, and we've helped many, many people over the years avoid these type of problems. Therapy and rehab, state-of-the-art facilities, individualized programs, ergonomic and postural instruction, individual rehab programs for the neck, back, shoulder, knee, ankle, whatever problem you have, we have individualized programs for you. Wrist, hand, finger, foot, ankle, knee problems, examples including tendonitis, rotator cuff, sprains, strains, carpal tunnel, people recovering from knee replacement surgery, hip replacement surgery. You can do your rehab here. We do rehab here as well for those type of issues. We've helped many, many people with those type of issues over the years, getting their therapy and rehab. Deep tissue massage, myofascial trigger point therapy, acupressure and reflexology, done right here at the American Back Centers. We have a great licensed massage therapist who institutes that. Comprehensive nutritional consultations, custom-made orthotics. We touch on this all the time, people getting orthotics made. They're custom. We have a computerized 3D scanner that scans your feet and gives you a nice printout of weight-bearing and any type of arch issues. So there's no error, as opposed to with the old casting kits where you're stepping in. There's patient and doctor error as the doctor pushes the foot down into the casting kit. A lot of times it's not going to be perfect if you're not pushing down exactly equal on all parts of the foot. With the custom-made, with the computerized scanning system, you take all that error out. The patient is simply standing on the scanner 1 foot at a time. The foot is scanned, and there's no error whatsoever with pushing a foot into a casting kit. So we get a truly custom-made orthotic that patients see the results with. Amazing. They're made in approximately 5 to 7 business days after we send over the scan electronically to the company, and they're fitted to your shoe, and they truly make a difference. So if you'd like to try to see if you're a candidate for the custom-made orthotics, please call our office, and we can schedule a consultation to set you up to see. And a lot of people that have trouble in their hips and the knees, they have issues related to the feet, whether it's bunions developing, hammer toes, fallen arches, and these all can be addressed with these custom-made orthotics, and in many cases taking your hip and back and knee pain away. And it's pretty amazing. Custom-made, we're not getting these off the shelf. We're not claiming to have custom-made and then going in the back and getting them off the shelf the same day. These are truly custom-made, and they're made and sent to our office once they're done being made. In-house X-ray, nerve conduction, ultrasound testing done right here at the American Back Centers, and we have a very convenient MRI facility, MRI CT facility right across the street, North Pittsburgh Imaging, that you can receive. We can send you right across the street, and you can get the MRI CT, and you come right back over. In some cases, if you're coming from a great distance, if we can get you in right away over there, you can do it the same day. Just bring the films over. We'll squeeze you in, take a look, and save you an extra trip out here. And many people, question when I schedule an MRI. I said, it might be easier if you just go right across the street, and they live in Ohio, West Virginia. But then I also tell them when you come back and you schedule, we try to squeeze you in the same day. So it's very convenient for them because they can get the MRI. They don't have to wait to get it. They get the films right away. In many cases, the report comes over within 20, 30 minutes after they got the MRI. So say you went to Morgantown, that's where you live, and got your MRI, you'd have to get that. You may have to wait a week in some cases to get the report back from that hospital, because hospitals do take a lot longer. And then in many cases, they won't even give you the films the same day. So that just makes it a longer period of time now that you have to wait to see if you're a candidate for the therapy. So our protocols are unique. We keep talking about how our protocols are physician-directed. Our protocol engages other modalities. We have over 20 years of experience, one of the most experienced facilities in the country instituting this type of care. And we screen out and decline candidates whose medical records and evaluation indicate we're unlikely to help them. So if we can't help you, we're going to tell you. But if we do think you're a good candidate, you have an over 92% success rate. And our success rate is based on our experience. We've been doing this for a long time. We've seen a lot of patients, and our protocol continues to get better and better and better. And like I said, we get the latest technology. We don't have 20-year-old VAX-D machines. We have the latest and newest VAX-D machines, and that's, again, what makes our success rate is even better, because even VAX-D continues to perfect what they do. And that's very important to note. So a little bit more about VAX-D if you are new to the show. Of course, you can learn more by visiting our website. There's also a 24-page color booklet we can send out to you showing you all the ins and outs of VAX-D. Of course, our website is www.americanbackcenters.com. There's a VAX-D therapy section, telling you about the VAX-D benefits. Is VAX-D right for me? What is causing my back pain? What can I expect from VAX-D? The science behind VAX-D. There's a lot of good things on the website that you should take a look at before you undergo any treatment. Always do your research. I always tell you that. Always do your research before you pursue any treatment option. VAX-D is the only medical device that delivers treatment through a patented logarithmic decompression curve. The treatment is designed to relieve pressure on structures that may be causing back pain, usually associated with bulging, herniated disc, or degenerative disc disease. VAX-D is safe, effective, and does not involve the risk associated with surgery or injections used to treat chronic back pain. Studies have proven that VAX-D reduces pressure within the disc from a positive pressure to a negative pressure. Average standing pressure on disc is a positive 200 millimeters of mercury. With VAX-D, a negative 200 millimeters of mercury is producing a vacuum effect on the disc, allowing for a suctioning of the disc material back into its normal position. Well, while back pain is usually treated with a combination of therapies, like I call it the gauntlet, medication, bed rest, chiropractic care, physical therapy, exercise, many of the treatments only temporarily reduce the symptoms. In contrast, VAX-D addresses the disc problem directly rather than just relieving the pain. A 4-year study showed that the majority of patients were still pain-free 4 years plus after completing VAX-D regimen. This was published in the Journal of Anesthesiology, which is a peer-reviewed medical journal. It's not something that some VAX-D provider did on his own. This is actually peer-reviewed and published in a medical journal. So, a little bit more about VAX-D. VAX-D has been successfully operating for over 20 years in the U.S. as well as worldwide. More than 3,000 patients a day are treated with VAX-D. Of course, here at our office, we've been doing VAX-D since 1994, and with that, we're one of the most experienced providers in the country instituting this type of care. As we mentioned, VAX-D is the only medical device that delivers treatment with a patented logarithmic decompression curve. So VAX-D can relieve pain associated with herniated disc, degenerative disc disease, posterior facet syndrome, stenosis, radicular pain, as well as numbness and tingling, and foot drop. Patients can avoid the costly and time-consuming merry-go-round of drugs and non-specific treatments like bed rest, physical therapy, injections, and back surgery. Vaxi has been used by the best professional sports figures in the NBA, NFL, NHL, Major League Baseball, Olympic athletes, and many, many others. So one of the other questions we see all the time is, are there any reasons why I cannot do Vaxi? Well, people that have conditions such as tumors, severe fractures, advanced osteoporosis. Now, in some cases of less severe osteoporosis, you can still receive this therapy because your bones are strong enough. But if you had advanced severe osteoporosis, you may not be a candidate for the therapy. And if you're pregnant, you cannot receive Vaxi therapy as well. How much does Vaxi cost? Well, my health insurance, auto, workers' comp cover it. In the state of Pennsylvania, auto and workers' comp covers Vaxi 100%. Insurance carriers vary from carrier to carrier. If you do have any out-of-pocket expense, deductible copay, we will tell you before you incur any expense whatsoever. And insurance coverage varies from state to state. Auto and workers' comp covers it 100%, and many insurance companies do cover it as well. If Vaxi works so well, how come I have not heard a lot about it? A lot of people ask me this. Vaxi is a relatively new medical procedure in the U.S. Treatment has worked for thousands of patients. Over 3,000 patients per day worldwide are being treated. The awareness of Vaxi is growing every day as physicians and healthcare providers learn more about Vaxi and its truly phenomenal results it has achieved in numerous clinical studies. As a result, Vaxi is now becoming the standard of care for chronic low back pain. So the other questions that we see commonly, too, is why should I consider Vaxi therapy? Of course, Vaxi is the original patented non-surgical treatment for low back pain and the only treatment that delivers Vaxi's patented decompression curve, as we mentioned many, many times. Another question we see all the time is how is Vaxi different from these decompression therapies I see advertised? Many patients, physicians have asked if Vaxi treatment is different from traction. In addition, the emergence and success of Vaxi therapy has spawned a host of new medical devices, copycats if you want to call it, all claiming to be the same as Vaxi in their principles of operation and their success rates. This has created a lot of confusion and questions about their similarities and effectiveness. Many doctors use simple traction devices, advertising them as decompression or disc treatments or disc therapy. They use a lot of different names, neutrodismosis, decompression. Although traction devices can stretch the low back, they have not demonstrated the ability to decompress the lumbar disc and spinal nerves. It is mind-boggling that these providers can make these claims that cannot be backed up through legitimate research that is published in medical journals. What does traction actually do? Traction does stretch the spine, but that's all it does. It's been around for over 50 years. If it worked, we wouldn't be discussing Vaxi. Traction tables have a small electric wrench that attaches to the head of a table. A rope and pulley are then attached to either a cervical neck device or a lumbar back belt. Either static, constant, or intermittent traction modes can be chosen, but neither have been shown to reduce interdiscal pressure and decompress the disc and nerves. Remember, Vaxi brings the pressure down to a negative 200 millimeters of mercury inside the disc, so it actually reduces the pressure within the disc, and that's unique to Vaxi therapy. What about the research I see about these other decompression devices? Another question I get all the time. And the answer is, isn't it interesting that Vaxi research is found on traction table websites? In other words, they're touting the success of Vaxi and falsely giving the impression that traction is equal to Vaxi when it certainly is not. This is similar to a car manufacturer advertising that their Model A car goes 200 miles per hour simply because Model X goes that fast. They both have an engine and 4 tires. They must be identical. These sham treatments are making bogus claims and falsely advertising that they decompress the lumbar spine and the disc when they have no published clinical studies to substantiate their claims. Some have implied, we've talked about this in the past, that NASA scientists discovered decompression, which is unfounded, and of course NASA sued them, and some of these companies went out of business, and now they're back in operation under different names. So it's very important to note this. We've talked about this before. It's very deceptive, and you have to be very careful about this. so you're not fooled. Do your homework, as I always say. So what should you do? Today's healthcare marketplace is full of super salesmen with new promotional campaigns that utilize scientific references. Unfortunately, what sells is not the quality of the product, but the ability of the marketers to influence their audience. Even when they realize the treatment method is unproven, they attempt to minimize this by mentioning it has been proven by the satisfaction of the FDA or one of the other recognized medical societies. The best way to avoid being taken is do your homework, as I tell you each and every week, when considering any new treatment. This includes our treatment. Ask for copies of published research on the treatment, including clinical and patient-relative outcomes. Make sure they can substantiate their claims of therapeutic value. Unfortunately, in today's healthcare market, separating the hype from the hope is no simple task. So be very, very careful and do your research, as I always say, before you pursue any treatment option. We have great before and after MRIs showing the disc herniation retracted, reduced in patients. Rehydration of the disc, you can see it in the pre and post MRIs. VAXD has that. VAXD, again, has the patented logarithmic curve, which is key to bypassing the guarding effect of simply stretching the body apart. That's how we're able to reduce the pressure within the disc. VAXD has reinvented the industry, creating the newest non-surgical spinal decompression dynamic mode, allowing providers to apply tension in an arc designed to follow the natural curves of the spine. And that's what makes VAXD unique, and that's why it's so effective. All right, we're going to give you a quick testimonial before we move on in the show today. This is from a Gregory. He goes on to state, my neurosurgeon was not optimistic. After 2 failed back surgeries, an MRI indicated that a third surgery would be problematic. The surgeon said he would do surgery, but with its risk and poor prognosis, he suggested I consider the possibility of just living with the pain of a double herniated L4-L5 disc. It was impossible to sit for more than 10 minutes. It became increasingly difficult to stand, walk, and at times even lie down. It was at a point that I considered flying to Washington, D.C. for VAXD treatment. I was told 2 treatments a day for 9 consecutive days. And that's what we can do for patients. If you're coming from a great distance, of course, we're going to try to find a facility closer for you. But if you're coming from a great distance, in many cases, you can do 1 treatment in the morning, 1 treatment in the late evening, right before we close. And you can do that twice a day. And in many cases, you can do that, and instead of coming out here, if you're traveling and you got to go home, you can do that for 2 days, 4 treatments over 2 days, instead of coming out 4 consecutive days for treatment. He goes on to state, I was told 2 treatments a day for 9 consecutive days. Frankly, even after watching the videotape provided by the clinic, I was skeptical. As it turned out, the only ordeal of the whole time was a plane trip to Washington. I arrived for my first treatment the afternoon I arrived. After 4 treatments, the pain had substantially reduced. By the end of the 18 treatments, the pain was completely gone for several days. When I returned, it would be a bare whisper of its former intensity. I was told I would continue to improve after the treatment. Again, I was skeptical. But I was so relieved to be 95% functional that I didn't really care. As I write this, some 10 weeks after my last treatment, I have marked 4 weeks of pain-free. The numbness is completely gone from my foot, and I am functioning better than I ever thought I would before the episode began. My many thanks to you and those who designed and applied the VAXD. It comes as close to it as an understandable miracle as anything I've ever had. So this is from a guy that's had 2 back surgeries, contemplating a third, was willing to travel all the way to Washington, D.C., to get his therapy. And, there are facilities all over the country now. There's over 300, so now in many cases you don't have to travel as far because it was something he was so desperate, and he wanted relief, and now he's pain-free and has no problems whatsoever. So again, if you'd like to schedule a free consultation at no cost or obligation, again, our toll-free number is 1-888-222-8293, 1-888-222-8293, or 724-935-3300. Of course, you can request a consultation appointment right on our website as well, www.americanbackcenters.com. We also have the free DVD. This is when Channel 11 WPXI did a medical breakthroughs report on our office. So you can get that sent to your home as well, free of charge. We also have the 24-page Keller booklet, which we can send to you as well. Just call our office and ask for information when you're scheduling your consultation, or if you want information prior to scheduling your consultation, we can send those out to you. We also have the blue workers' comp booklet and the yellow auto accident booklet as well. These are great resources for you. If you're hurt at work, in a work-related injury, or an auto accident, personal injury case, they're both done by attorneys. We have many great resources here for rehab and therapy of disc problems, of course. If you lifted something at work, you may have a diagnosis of a sprained strain. You may think, now that the pain is traveling down your leg, you're going through the workers' comp panel doctors, and they don't seem to be helping you. If you know somebody in this situation, tell them to give us a call. In many cases, these workers' comp doctors are very hesitant to order an MRI, because once they see the diagnosis of a disc problem, now it creates more money for them, for the workers' comp insurance carrier and the employer, and now the patient's going to be off work longer. So sometimes they want to avoid that, and their whole purpose, unfortunately, I hate to say this, is getting you back to work as soon as possible. So if you're in that scenario, you know someone in that scenario, number one, call and get the blue workers' comp booklet so you know your rights, so you're not being taken advantage of, but also tell them to give us a call. You can come on in, we can do a free evaluation and see if you need an MRI, and then from there, you may have a disc problem that can be effectively treated with our specific disc treatments we offer here at the American Back Centers. Also, whiplash cases, we have a lot of great rehab and specialized treatments for whiplash, car accident cases, so we can do it right here at the American Back Center. So again, call and ask for the blue workers' comp booklet or the free yellow auto accident booklet. They're both done by attorneys. And again, making sure you're not being taken advantage of in those type of scenarios. All right, before we get into the nutrition segment today, just quickly, there's a couple nutritional supplements I want to highlight. Remember, we do have the CBD hemp oil and the hemp cream. Amazing, amazing results we're seeing with this. Completely safe, completely legal. Some patients that have been taking prescription pain pills, and then they try the highest level, the level 5 of the CBD oil, I should say the cream, are amazed that it actually works better without any side effects. Completely safe. And then the hemp oil, seeing great results with autistic kids, epilepsy, with seizures, as well as Parkinson's with tremors. So if you know someone who has a tremor and you'd like to give it a try, it's completely safe. Hemp oil, and I'm sure you've read a lot about it in the news. Completely safe, completely natural, and why not? Give it a try and see if it helps with those tremors, with a seizure. It's not going to cause any problems. There's no known side effects with this product. Even autistic children seeing diminish or lessening of their negative behaviors. If you want to call it negative, some people may call the behaviors typical with autism negative, with the regular use of hemp oil, which is administered sublingually underneath the tongue with a dropper. And we offer both products here at the American Back Centers, the CBD cream for pain and the CBD oil for those conditions I just mentioned. So call our office. If you'd like to give those a try, we can send them to you. You can pick them up right here at the American Back Centers. All right, we're going to get into the nutritional segment. Last week we talked about how to safeguard your bone health naturally. 1 in 3 women, 1 in 5 men over the age of 50 will experience osteoporosis-related bone fractures. 20% of those who break a hip actually die in the first 12 months following the fracture. We touched on that 2 weeks ago when we were live. We talked about some weight-bearing exercises that are particularly important for prevention of osteoporosis, which is characterized by porous and frail bones, eating a diet of real food, getting sufficient amounts of specific nutrients, which we touched on last week, talked about, or 2 weeks ago. I keep saying last week. We were taped last week. We were live 2 weeks ago when we talked about this. Talked about the importance of Ultra K2D3 when you're taking calcium, to make sure you're not doing things in your diet that are taking calcium out of your bones, like soda pop, other inflammatory foods, cigarette smoking, alcohol, which leaches calcium from the bones. And when you're taking calcium supplementally, making sure you're getting vitamin D and K2, the K2, making sure that calcium does not go into the arteries and calcify the arteries. We have great products, which we mentioned, Ultra K2D3 in a chewable form, which is a wonderful way to do that. We also have the L-arginine Complete, which has the K2 and D3 in the product as well in therapeutic levels, which can help you when you're supplementing with calcium, avoid calcification of the arteries. So we touched on all that. This week we're going to be touching on number of people suffering from osteoarthritis has doubled. And if we don't have time, we'll talk about some of the dangers of the drugs that you may be taking when you're on arthritis this week or next week. So definitely stay tuned for that if we don't have time for that today. So he goes on to say, this is from Mercola.com, MERCOLA.com. You can go to his website and download this article. Or you can go to my Facebook page, American Back Centers Pittsburgh. Take a second to like our page, and you can also take a look and read the article. And any article we'll be touching on our live shows of BackTalk, as well as you can print it off right from the Facebook page. And I ask only if you don't have a computer or printer or the Internet, only if you don't have those, we can send these articles out to you free of charge in those scenarios. We have no problem doing that. We just don't want to be sending it out to every Tom, Dick, and Harry, because the postage could get quite expensive with that. So, he goes on to state, arthritis is a general term for over 100 different conditions that affect your joints and surrounding tissues. Any joint in the body can be affected, but the most common are the knees, hips, hands, and wrists. Two most common forms of arthritis are osteo and rheumatoid arthritis. Both forms of this disease cause significant pain and discomfort in the joints, but the triggers behind the conditions are different. RA is an autoimmune disease where the body's immune system mistakenly attacks the joints by releasing enzymes that damage the lining. This disease is chronic and progressive, very inflammatory, causing inflammation that results in painful deformity and immobility. This usually occurs in the fingers, thumbs, wrists, elbows, shoulders, knees, feet, and ankles. Can also cause inflammation in the lungs and eyes, nodules under the skin, fatigue, fever, and weight loss. 1.5 million people in the U.S. have RA, including my mother. Nearly 3 times more women than men have the disease. Next paragraph, as we skip on down, osteoarthritis. What is osteoarthritis? OA, or osteoarthritis, is more commonly affects the weight-bearing joints in the body, such as the knees, hips, lower back, neck, and small bones of the hands. The joints more often affected are those repeatedly used performing a task or playing a favorite sport. Hips, knees, bones in your hands, lower back may be affected from carrying excess weight. Injury or repeated wear on the joint may cause the cartilage between the bones to wear, resulting in bone rubbing on bone. As a result, you lose joint flexibility. Bone spurs can develop, just like we see with compression of the spine and the disc, and you experience joint swelling and pain. Nearly 10% of men and 30% of women age 60 and older will suffer from some form of osteoarthritis. Some of the factors that appear to increase your risk of OA include obesity, so if you're overweight, more prone to getting osteoarthritis. Lack of activity, if you're not walking, you're not getting regular activity, you're sitting in a chair all day, you retire. Instead of staying active, you go and sit in front of the TV. Increasing age, female sex, repeated knee injuries, muscle weakness, repetitive joint use, high bone density, joint laxity, poor posture, occupations that require repeated squatting and lifting, congenital joint or cartilage deformity can make you more prone to osteoarthritis. In addition, suffering from other types of arthritis earlier in life, such as septic arthritis, gout, and RA, may increase your risk of developing OA as you age. Other medical conditions may also affect your joint health and either increase the risk of developing OA or hasten the degeneration you're already experiencing. Some conditions include underactive thyroid, diabetes, gout, and Paget's disease of the bone can make you more prone to osteoarthritis. Oftentimes, the first symptoms of OA is an unexpected increase in pain and swelling in the joints that doesn't correlate with your activity level. The reference standard for diagnosing OA has long been changes noted on an X-ray image in the joint spaces. The severity of the disc is graded 0 to 4, depending on the evidence of specific changes in the joints, such as bone spurs, deformity of the joint, and joint space narrowing. You've heard people talk about, and doctors talk about, bone on bone in the knees, bone on bone in the hip, Well, that's those bone spurs forming, just like you see in the disc in the back. We don't want bone on bone. When you simply just do pain meds, pain shots, even surgery, just snipping off that disc, it's still not addressing the compression of the joint space or the disc space. In the case of a disc, those bone spurs still continue to form, just like I tell you, the stalactites and the stalagmites in the cave, forming from the top and bottom of the disc, the vertebral body, surrounding the disc, I should say, and eventually will fuse together. Same thing happens in your joints, and the knee and the hip as well. So we're going to skip on down. They go on to state the risk of osteoarthritis is higher than your grandparents' risk. As a result of degeneration in the joint spaces, eventually the bones begin to rub against each other and produce a distinct glass-like polish that is readily identifiable in skeletal remains. This was the indication that researchers used as they searched through the remains of 2,500 people spanning more than 6,000 years. And when they compared cadavers then and now, the rise in incidence of OA is staggering. All the remains were from people over the age of 50. Researchers analyzed over 1,500 people who died between 1905 and 1940, 819 who died between 1976 and 2015. They found that knee osteoarthritis was 2.5 times more common when you were born in the post-industrial age as when you were born in the late 1800s. They also found the rate of having OA in both knees and the post-industrial age was 1.4 times higher. Inactivity may play a leading role in this. Number one cause of disability in the U.S. is arthritis. People are much less inactive as they were back 50, 100 years ago. People aren't doing as much. Things are more automated now, and they're not active as much as they were. So the body was designed to move, not sit for long hours. And that's what we're seeing a lot of times with people that are older now as opposed to way back when. Omega-3, some other things we want to consider. Omega-3s may help prevent osteoarthritis. Another factor in the development of damaged cartilage leading to osteoarthritis is deficiency in omega-3 fats. Animal models using arthritis-prone guinea pigs have demonstrated that diets high in omega-3 fats not only help prevent the condition, but also reduce the symptoms in animals already affected by osteoarthritis. So supplementing or getting more omega-3 in your diet is very, very important. Yet again, as we stress over and over and over, eating the salmon, the anchovies, the sardines, the mackerel, wild-caught salmon, as I mentioned, almonds, walnuts, natural grass-fed meat, natural omega-3s, getting that omega-6 to omega-3 ratio down, supplementing with a good quality omega-3 supplement with a high level of EPA, DHA. I stress that over and over. All fish oils are not equal. You see that 2,000 milligrams of fish oil on that Giant Eagle Costco fish oil, and you assume it's good. But of that 2,000 milligrams, how much is concentrated EPA, DHA? You need to look at that label, and that's important. I even had this issue with my mother, who was taking a very reputable, she thought reputable fish oil that said 2,000 grams of fish oil, but it was only 300 of that 2,000 EPA, DHA. That's what's going to reduce the inflammation, the EPA. The DHA helps with other things, brain health, pregnant women as far as fetal development of the brain, those type of issues. But you need to have the concentration of EPA, DHA in that total concentration of fish oil. The importance of vitamin D, another important factor to consider with osteoarthritis. Important component stimulates over 300 antimicrobial peptides that are more powerful than antibiotics, which helps regulate your immune system. Vitamin D, a potent factor in maintaining good health while fighting inflammation, whether it's rheumatoid or osteoarthritis. Using hyaluronic acid in bone broth to reduce pain and inflammation. Key component in cartilage regrowth, responsible for movement of nutrients and waste products in and out of the area with little blood supply. We have a great product here with hyaluronic acid in the product, as well as glucosamine and MSM, all working together to rebuild that cartilage and help reduce pain and inflammation. The use of bone broth made from animal bones. The homemade version will differ greatly from the commercial canned variety Bone broth simmered 12 to 72 hours using animal bones, vinegar, and spices. The longer the broth cooks, the more gelatin, minerals, and other nutrients from the bones are released. Very important to help rebuild what's being damaged. Natural pain relievers. Looking at your diet, anti-inflammatory diet. We have great worksheets here showing our patients that come in here. We can also send it to you if you would like a copy of it, of the anti-inflammatory foods and the pro-inflammatory foods you should be avoiding. We talk about ginger, boswellia. We have a great product called Boswellia Complex with boswellia, ginger, and turmeric. All natural anti-inflammatories, which work exceptionally well as an alternative to these prescription pain pills. As well as bromelain, we mentioned cayenne cream as well. So next week, we're going to touch on some of those prescription medications you may be using for arthritis and why you should not rely on them and how they can be very dangerous for your health as well. Next week, we'll also touch on, if we have time, the topic of headaches, how you can deal naturally treating these headaches, of course, coming in and getting assessed to see if you need an adjustment, any type of cervical distraction treatment that we have that can open up those foramen and take the pressure off the nerves, can be triggering headaches as well. We look at your diet, your lifestyle. We're going to be touching on all this next week on BackTalk, so definitely stay tuned for avoiding and treating headaches, our topic next week, as well as we'll finish off touching on some of the medications that you may be taking with arthritis and some of the dangers and some of the issues you may want to be concerned with. So definitely stay tuned for BackTalk next week when we touch on that. All right, we are short on time. Just got the beep there. So as always, as I mentioned this week and every week, remember, do your homework before pursuing any treatment option. Ask for the research. Go on the Internet. There are many scams out there trying to just get you in the door and make money off you, unfortunately. With VaxD, you don't have to worry about that. It's a proven treatment with a proven track record, time-tested treatment. 300 facilities worldwide use VaxD, medical doctors, orthopedic surgeons, chiropractic physicians, physical therapists. 3,000 patients a day are currently being treated with VaxD. None of these so-called disc treatments can even come close to that. Used worldwide, accepted by all fields of healthcare, as I just mentioned, and most importantly, it's something that actually works. With VaxD, the results speak for themselves. I want to thank you for listening this week. We'll be on every Wednesday, next Wednesday and every Wednesday with another episode of BackTalk. This is Dr. Peter Pedduzi. Have a good week. Bye-bye.
You've been listening to BackTalk with Dr. Peter Pedduzi, sponsored by American Back Center, 103 Bradford Road, Building 2, Suite 100 in Wexford. For more information or to contact Dr. Pedduzi for an appointment, call 724-935-3300 or toll free 888-222-8293. That's 888-222-8293. And join us again for BackTalk with Dr. Peter Pedduzi.
At American Back Centers, you've got nothing to lose but the pain.